Now, for Men's Health Month, we also have to discuss cancer, right? Because probably secondary to heart disease is going to be cancer. Now, there's multiple kind of cancers that are common in men. Probably one of the most common is prostate cancer. Then we have testicular cancer, and then we have colon cancer. So first of all, let's talk about prostate cancer. So your prostate, what is it? So essentially your prostate, right? Here it's a gland, and it's going to sit at the base of your penis. And what your prostate is going to do is going to help basically it's going to allow you to urinate. And so it's going to help to prevent the urine from leaking out of your bladder. And your prostate is also going to help you producing semen. So in the semen production is basically a mixture of your sperm cells along with semen collectively is what we have whenever we ejaculate. So the organ is important for helping, that this is where they all come together. Inside of this prostate organ is where your seminal vesicles will be dumping into your urethra, also where your urethra comes out from your bladder. It's all going to be here. So your prostate is kind of like this little command center, like a traffic light of who's going to be going where. So your prostate is extremely important for your health. Now, for your prostate, cancer is one of the most common ones, is one of the most common cancers guys get is prostate cancer. So how do you screen for this? For prostate cancer, what you should be doing is getting a regular PSA test. That's a prostate-specific antigen. And the reason I want to emphasize about doing this test regularly is basically because as you age, your prostate number is going to change, right? So our prostate, like we said, is here, sitting here at the base of your penis. It has a PSA is a prostate-specific antigen. It's almost like a little flag. So the more of these flags you have, the bigger the problem. I always kind of think of like an accident. If there's 1 or 2 flags on the road, maybe it's not too bad. But if there's hundreds of flags, you know something serious is going on. So the reason we want to check for this PSA constantly every year is we're looking to see if there's any changes in this PSA. Now, changes in this PSA is called PSA velocity. So your PSA should be anywhere from 0.0 to about 4. So that's the range that we see on blood work. Now let's say you start testing your PSA and it's 1. Okay. Next year it's 1.1. Okay. 5 years later it's 2. That's not going to be that alarming. But let's say we check your PSA and it's 4. Well, then we kind of start scratching our head. Well, what's even more important is this velocity that I mentioned. So that's the change of this PSA value over the course of time. That's what's very important. But how do you get these values? You only get it from testing routinely. So I do suggest that you guys go in for an annual physical exam. At the annual physical exam is where they will draw your blood and they'll start to collect these PSA values over the course of time. So that's what gives us data. Always keep in mind, guys, the sooner you discover cancer, the better. So don't be scared of this blood test. Now, of course, in your prostate, DRE, that's a digital rectal exam, right? So the digital rectal exam is the one thing that guys don't want to do, that they're scared to death. So when a guy's turning 40 or 45, the idea of having to go to a doctor's office, drop your pants, be exposed, and then having the doctor put his finger into your rectum to feel your prostate is not appetizing. Nobody wants to do that, and I get it, guys. I totally get it. So what's the point of the DRE, right? So the point of the DRE is to feel cancer. That's what it is. So what I try to tell guys is I understand it's not fun, and I understand you don't want to do it. Come on, look at us too as physicians, right? We don't necessarily want to be doing this on you guys. But if you had cancer and you could feel it, if you could touch it, wouldn't you want to do that? So I just kind of give an example. If you had cancer somewhere else on your body, like on your leg or so forth, if you go in there and touch it and you could feel cancer, and that's one of the ways you could discover it was simply touching it and feeling it, why wouldn't you do it? So the DRE, that's basically where we're going in. We're going in there and we're trying to feel your prostate. You want to feel how big it is. You want to see if it's nodular, basically are there growths on it, or is it a regular size and is it smooth? So by doing this once a year, your doctor is going to make notes and trying to give you an idea like, okay, this is the size of his prostate, this is what we feel or what we didn't feel. Again, it's just collecting that data. Now, there's another test you can do, it's called an MRI, a prostate MRI. So the prostate MRI is a test that we do suggest. This test for most men is considered non-invasive, right? So you do have to go into an imaging center and they are going to take a picture of your prostate. Because one thing to be very clear about, in the terms of screening for prostate cancer, to diagnose you with prostate cancer currently is something called the gold standard. And the gold standard is only a prostate biopsy. So whenever they do that and they go and they do the prostate biopsy, it is not fun. It hurts and it's uncomfortable, and nobody's going to like that. Currently, with our current medical model, that's the gold standard to discover if you do indeed have prostate cancer. So then you want to ask yourself, well, then why are we doing these other things? Why am I doing my blood? Why are we doing the digital rectal exam if the only way to truly tell if I have cancer is with a biopsy? So we're trying to get different data from different points, and we start to put this picture together. How do his PSA values look? What did his DRA indicate? Now we also have an MRI, which is awesome, which is actually a really good test, and I highly encourage you guys to do this if you have any signs or symptoms. If anything's looking funny here with the blood work or that DRE, we're always going to send a guy in for a prostate MRI. We usually do this before they do a biopsy. And these MRIs are really awesome, and they are super detailed. I wish we had one simple test that you guys could take and it would tell us if you have it or not. Unfortunately, that's not where we are at. I'm sure we're going in that direction. So just as a little side note, we do have another blood panel that we do that is specifically for screening 50 plus cancers. So that is it's called a GREL test. We can do that here at the practice, and that's for basically screening for cancers via blood work. So that's another thing that's an option for you too. So prostate cancer, like we said, it is common. Your family history is important here. So if you have a father that has prostate cancer or a close relative that has prostate cancer, you're at a greater risk of getting prostate cancer. If you're overweight, if you have diabetes, if you're obese, those things also increase your risk of prostate cancer. So what are some of the things we can do to decrease our risk of prostate cancer? Well, the good thing about that, if you change your diet, lose weight, eat a lot of green vegetables, that will help to decrease your risk of cancer overall, including prostate cancer. Another fantastic way to decrease your risk of prostate cancer is to have sex. Yes, having sex is a good way to reduce your risk of prostate cancer. So if I'm having sex, how is that going to help me reduce my risk of prostate cancer? Well, basically, whenever you're having sex and you ejaculate, what's happening whenever you ejaculate, your prostate contracts. So here's a little larger model. So whenever you ejaculate, your prostate is going to contract. When your prostate contracts, you're basically squeezing it, you're working out, you're getting fresh blood in there, you're getting fresh oxygen in there. In a way, you're almost kind of like, you can think of flushing it out. I try to tell you guys, think your prostate kind of like a sponge. If you had a sponge that was sitting there on the counter and it never gets wrung out, it's going to start to become stale and stagnant. In your body, you want nothing to become stagnant, which means you don't want anything to stop moving. As soon as things stop moving in your body, you're going to end up having a problem. So as men get older, they tend to have less sex. As men get older, they tend to ejaculate less. So this ejaculation does not have to come from intercourse. It could become via masturbation or whatever the means might be. But ejaculation is one of the things you can do to help to reduce your risk of prostate cancer. So that's good news, isn't it? Changing your diet, eating clean, ejaculating, those are some things you guys can do to help reduce your risk of prostate cancer. First and foremost, you want to try to discover this stuff early. So if you guys have any questions about this, when you come into the practice, please feel free to ask us. That's what we are here for. Remember, guys, for all cancers, the sooner you discover it, the better. And with prostate cancer, if it's discovered early, there is pretty much an extremely high percentage survival rate. We're talking 99, 100% survival rate if it is found early. We have a lot of doctors that we work with within our network. We have some excellent urologists. We have some excellent oncologists. We have personal connections with. If we discover anything, we will get you guys down the road of health super quickly.